So this patient's coming in for removal of a mobile mass. It's fairly big on her elbow. I've marked the incision line, but it actually extends beyond that. Seems most consistent with a cyst. Thing seems bilobulated, so it's like going through here, and then there's a smaller tail through here. Like I said, feels cystic. Could be lipomatous as well, but doesn't quite have that same quality. So we're just going to dissect that down and then sort of see what we're dealing with and then remove that. Stipulates has been growing for about 3-4 months. A little bit fast for this, but could be. So we'll see what that's dealing with. So no pain when I do that to her? It doesn't hurt?
No, I don't think so.
Okay. There's a bit of a language barrier with the patient, so we'll have to explain things the best we can. So just let her know that from this point forward, she shouldn't feel much more than just pressure. So if she feels anything more than that, let me know and I'll add more freezing in. Okay? All good? Okay. And then we'll hope to get this. This position is probably not terribly comfortable for her either. Scissor number 15 blade. So skin here is very thin. So like most things in life, there's good and bad to having sort of thin skin and redundant skin. So from the repair perspective afterwards, having this come together will be a bit easier, but it gives a bit more than regular skin does, which makes it a bit more difficult to work with. So when you're doing your initial incisions, shifts a bit more, gives a bit more than you would ideally like.
नहीं मैं ठीक है कोई कहीं जाना मैं
नहीं मैंने जो पेन ज़्यादा होगा दर्द होगा मैं दस दिन
अच्छा
ਉਹਦਾ ਤੁਹਾਨੂੰ ਫ੍ਰੀਜ ਕਰਤਾ ਨੇ ਦੋਨੇ ਸਾਰਾ ਉਤੋਂ ਫ੍ਰੀਜ ਕਰਤਾ ਤੈਨੂੰ ਪਤਾ ਵੀ ਲੱਗਣਾ
हाँ तो पता नहीं लगता
I hope none of that's nasty.
My voice coming on YouTube.
Oh, okay.
That'll be okay.
So the other thing you get into in these areas too is there's a burst that overlies the elbow as well, and sometimes that can get acutely swollen and give people trouble. That looks slightly different as well, so we'll have to see when we remove this what we're dealing with. She's okay?
Yeah.
So essentially all I'm trying to do here is break down adhesions, and just like any other cyst we would do is we're just trying to get it down to the point where we can see that we're behind it into the hypodermis, and then see if we can dissect that back around the other way. Got that for me? Okay. Just tab that for me. Tab that. Can you grab me the scissors?
This one big one.
Yeah. This is the area that felt like there's a bilobed compartment to it, so I'm just progressing a bit slowly here to see if I can actually get around that. I'm gonna sit back down. She still comfortable?
Yeah, look like.
Does that hurt?
Lite medalj.
No.
Oh, your throat hurts.
That's the whole thing. She's gonna.
It's a dog.
ਕੋਈ ਗੱਲ ਨਹੀਂ ਉਹਨੂੰ ਕਰ ਲੈਣ ਦੇ ਉੱਥੇ
It's a dry throat.
Yeah, little bit she said.
Sabi dyan, may kar Halloween.
So it seems like a lot of bleeding here. These are just small capillaries that are rupturing. Just put it underneath it right again. See the small capillaries just there? Get that out in a second. So see if I can get around that. So at this stage, I'm not trying to rupture the membrane. I'm just, sometimes when it's intact and it's tense, I can actually see behind it a little bit better. Just gonna have you remove this in 1 second, Rada.
Mm-hmm.
Let's take that off, right? Pull that back. Grab that. Just some subcutaneous tissue right there. Looks pretty clean, so we're going to clean this up in 1 second. I'm just going to put this here. You're okay? Good?
ठीक है.
So this is the part you could tell from the outside where it looked like it had a secondary lobe, which was here. Now whether this is full of, we'll take a look. Yeah, so it's all cystic. So that whole thing is cystic. So and this is why I try to not rupture it, just so we know that it's completely removed. So we'll send that off to pathology, which should be good. So you can see here, Tim's tissues are thinner, so just above, see the the tendons underneath there? That's just at the back end of the hypodermis. I'm just going to irrigate this. Now these ones typically when I take out a cyst, especially an uninfected cyst, like a lot of times we don't, actually the majority of times.
Oh, here, that's the
We won't use antibiotics, but this one, it's this close to a joint, I would, just to be careful. It's not hurting at all?
No.
No pain?
No. If she pains, she gonna feel it. Not feeling nothing.
So again, most of this is just superficial stuff. As I was telling you before, I don't mind a little bit of oozing. And the advantage we have here with something that's on your arm, we can put a compressive stocking or dressing. That should catch these and tamponade them for us anyway. Alright, just put pressure on that one, rather.
Sure.
Grab it. So this is where there is some advantage for the redundant skin. Whereas normally I'd certainly put in some dermal stitches here. I'm going to elect not to because I think we'll get away without it anyway. So it appears like a lot of bleeding here. It's all coming from vessels right along the margin of the skin. And that's why I'm just electing to close this. And I should be able to just do a pressure dressing, and then that will take care of those. She's still comfortable?
Yeah.
So I'm just cleaning that out. So we should be seeing that as I progress along with this, that there's less oozing coming out bottom because we're tamponading these vessels. And this is why this is a bit different than I would be handling this if this was deep in the back or intra-abdominal. Yeah, I'm gonna need another one. So we're almost done.
Thank you.
Thank you. So you can see here it's not bleeding as much anymore. That's because through here, you can see there's still oozing where those vessels are slowly tamponading. So that means the vessel's been compressed, but it's just oozing just a little bit. And that won't cause a problem from the standpoint of post-op hematoma or anything like that. And then the other advantage is here, let's even say we had a brisk bleed and we couldn't locate the vessel for whatever reason. You can just put a lot of pressure on this because there's a bone at the middle of it that'll compress back and allow that to stop. Go. So we'll just clean this up with some chlorhexidine, and then we'll put a dressing on that, and then we'll see her back in about 10 days.